Namaste. Distinguished guests, dear media friends, and esteemed members of the healthcare fraternity, welcome to the Easy Check Breast press conference. These cancers are also associated with about 90 lakh deaths every year. This translates into roughly 34 new cancer cases and 18 cancer-related deaths every minute. In India, these cancers contribute to 12 lakh newly diagnosed cases and 7 lakh 60,000 deaths every year. Unfortunately, most cancers are detected at advanced stages, which necessitate more intensive and expensive treatments, which have greater risk of debilitating side effects and treatment failure. On the other hand, detection of cancers at early stages is vital for successful treatment. Lower treatment costs, lower toxicities, and improved survival. Hence, governments and healthcare organizations globally have a clear mandate for early cancer detection based on screening of healthy population who do not have any symptom or suspicion of cancer. Easy Check is a new paradigm in cancer detection to nip cancer in the bud. It is a breakthrough non-invasive blood test that can detect cancers at early stages in asymptomatic individuals with high accuracy to save lives and preserve quality of life. Breast cancer is the most common cancer in women in India and accounts for more than 26% of all cancers occurring in women in our country. The survival of breast cancer patients varies hugely from 90% in early stage detection to only 22% with late stage detection. The Easy Check Breast is based on the concept of identification of circulating tumor cells, and it scores very high on sensitivity and specificity. It is a simple blood test intended to be performed annually as a screening test in individuals without any symptoms suggestive of cancer. We are happy to announce that we are introducing Easy Check Breast test across our group facilities in Delhi, Kolkata, Chennai, Navi Mumbai, and Hyderabad. I request you all to please join me in welcoming our distinguished panelists for the launch of this cancer genetics. So please join us on stage. Dr. Bose is trained in molecular oncology from the University of Pittsburgh Medical Center, USA. After his MBBS and MD in pathology, Dr. Bose received training in hematology from Karolinska Institute, Sweden.
Maybe that was a very auspicious and a powerful start to review.
And the data genetics that they have started. So have made this possible for people across the world to face a huge problem which in majority of the people faces a serious consequences. The word cancer was like a death sentence before. 3 decades you have seen what Apollo has brought to the country is a clinical excellence in almost every single discipline. Being a cardiologist, I can proudly say that today in India, we do the cardiac surgeries, cardiac procedures and cardiac surgery equivalent to the best centers everywhere in the world.
Managing Director, Polo Group of Hospitals from Hyderabad.
Make the environment as friendly as possible. It is a difficult thing for the baby to undergo if she's being treated for breast cancer in stage 3 and stage 4. At this moment, I would like to take a minute to really congratulate all our cancer survivors, the brave women who come into this fight, who work with the clinical team, and who have overcome. And I'm happy to say that, with our doctors and the technology, we have among the highest success rates in the world. But now we're taking this fight one step further and saying all the women detected, we want to detect more early stage cancer so that we can treat painlessly or relatively painlessly and have higher success rates and much higher survival rates for the country. So thank you to Datar, thank you to our wonderful clinicians.
To you, a short audio visual on Easy Check Breast.
And middle income families have died of breast cancer. Isn't that really disturbing? Should we not do our bit?
Are detected with breast cancer every year. 1 in 22 urban women in India are at a risk of developing breast cancer. Early detection is the key to winning over breast cancer. Apollo Cancer Centers, along with Datar Cancer Genetics, is glad to be introducing the revolutionary blood test, Easy Check Breast. The test has been granted Breakthrough Device designation by the US FDA, with an overall accuracy of about 99%, and has been clinically validated by one of the world's largest clinical trials. Now you can detect breast cancer earlier and easier. Book a test now. Visit apollocancercenters.com or simply call 1-800-203-1066.
Request Dr. Chirantan Bose, Director of Patient Care Services at Datar Cancer Genetics, to kindly address this wonderful gathering.
To everyone who has taken the effort to come here, thank you so much, the management of Apollo Hospitals, and we are really thankful to this largest private healthcare group in India to take such an important initiative. Now, the agenda today is to sensitize the importance of breast cancer screening. As has been already said, about 1 in 22 will develop, 1 in 22 women in India will develop breast cancer. The sooner we detect it, the better pitched we are to treat and to cure the patient. Your attention on the top left histogram, where Europe has about 500,000 females detected with breast cancer every year and a mortality of 1.4 lakhs. In India, if you contrast it, there are about 1.8 lakh females detected with breast cancer and 90,000 deaths. So about half of the volume of females. In UK, it is about 46% detected early, 36% in the mid stage, and 4% in advanced stage. In India, 80% females are detected in mid to advanced stage, about 10% in very advanced stage, and only 10% females with breast cancer are detected in early stage. This is what we are attempting to change, because if more females are detected in early stage, the better the treatment and the more is the probability for cure. Females detected in middle-income countries died of breast cancer in 2020. And there is a marked inequality in the mortality of breast cancers, which I just showed to you. This is WHO data. And because of the barriers in low and middle-income countries, the advanced stage cancers patients are more likely to have a fatal outcome than in developed countries. Now, the examination or processes of screening now, what we know are the following: self-breast examination, breast examination by a medical doctor or an expert, screening mammogram, and ultrasound of the breast. These are the existing screening methods. The problem is that there's an urgent need to enhance screening, as we have seen that we have insufficient screening and hence more patients are detected in relatively advanced stage. Easy Check Breast is a simple blood test which allows the screening for even early stages of breast cancer by detecting circulating tumor cells in the blood. This is the technological enhancement now, that we can detect actual tumor component in the blood. It is not a surrogate marker. And it requires just 5 ml of blood. I wouldn't bore you with the details of the research, but there have been extensive clinical trials, this one with more than 8,000 asymptomatic individuals who were screened. And the method is that the circulating tumor cells are picked up from 5 ml of blood sample and then stained with different types of fluorescent dyes, and then the image is juxtaposed with an artificial intelligence to identify that this is coming from breast cancer. There are various markers for breast cancer, specific cells like Datar, GCDFP15, etc. And this test is recommended for asymptomatic, otherwise healthy females over 40 years of age. So it's a non-invasive test, it does not require a hospital visit. The blood sample can be collected from any collection center or home, just 5 ml. It has a very high sensitivity of 88% and a specificity of over 99% and an accuracy of more than 99%. So it detects circulating tumor cells at a very high level, more than 80% in stage 0 or very early breast cancer, more than 90% in stage 1, and 95% in the mid-stage, stage 2, stage 3, and 100% in stage 4. It is a care pathway so that their disease can be managed. We received the breakthrough device designation from US FDA and under the name of Trinetra, which is our global brand name for the test. Datar Cancer Genetics Laboratory is extensively accredited with the ISO 15189, CLIA standards, CAP regulations, CE, TUE, etc. So, as I said, the Easy Check test has been recognized with a breakthrough designation by US FDA. The marketing authorization in the European Union is with the CE-IVD mark, and Easy Check samples are processed in a fully accredited laboratory in India. It does not aim to replace the standard of care methods of breast cancer screening, but the aim is to reach more females across the country, in the length and breadth of the country, through this simple blood test. So our mission is to make India breast cancer free by early detection so that it is cured. Thank you.
Request Dr. Ramesh Kareem, Senior Consultant, Surgical Oncology at Apollo Delhi, to kindly address the audience.
And Dr. Mrs. Ramesh Kareem, the surgical oncologist specializing in breast at the Indus Apollo Hospital, New Delhi. You've heard a lot about the incidence, the late-stage diagnosis, and how the breast cancer is increasing and its incidence in the women. I will take you on a little different path. And that is that till today, we do not know why breast cancer happens. We know who are at risk. There is a lot of research, but why one gets it and the other doesn't get it? Even people with risk factors may not get the breast cancer, and those who don't have a risk cancer, don't have a risk factors, will get breast cancer. So if we do not know why it happens and what we can do to avoid it, what's the next best thing? The next best thing is, if God wants to give you breast cancer, then we should be able to diagnose it at a stage where a small surgery or small thermal ablation or a small laser ablation will do the trick. Breast cancers less than 1 centimeter of any type do not really require chemotherapy. And you know, chemotherapy can be very, very expensive. And now with molecular targeted drugs, the breast cancer treatment can cost you 50 lakhs to 1 crore. How many of us can afford it? So if we want to avoid all that, the next best thing is to diagnose it when it's early in the course. And for early diagnosis, you already heard, but to repeat, for early diagnosis, either you feel the lump or have the symptoms, or even before you have the lump or the symptoms, we should be able to tell you with a blood test, with a mammogram, with an ultrasound, that look, you are having a breast cancer less than 1 centimeter, 1 millimeter, half a millimeter, or 2 millimeter tumors. And once it is that size, then of course our lives are saved, and our families are saved, finances are saved, our houses are saved, our family is saved. So I keep telling women, we are the most important part of the family. We are a thread with lots of little pearls of our family around it. And so your health is very important. So you must know what are the early signs, and you must come to us for screening tests. And this is another screening test with a technology advancement of an easy one. We also say the screening test should be something which can be repeated, which is easy to do, which is not taking you to time to travel to make an appointment, and it's reproducible and it's cost effective. So that every woman in the lower income and middle income strata can have this test available. And I think this is a step towards that. So there are advances in the treatment, in the technology all over. So this is another step towards diagnosing cancer before it becomes palpable to you or before it becomes symptomatic. And especially we are launching today the Easy Check Breast, and I'm sure they have other cancers in the pipeline. So having said that, that we needed another test which complements our armamentarium of early diagnosis of screening. Screening means asymptomatic women who have no symptoms, no discharges from the nipples, no lumps, no pains, no nothing. So, as we said, it is a great step, and as you already heard, that it's very specific. And simple thing is, when a cancer happens, it produces or it already has vascularity. In fact, it has more vascularity because it needs to be fed with the elements to divide. So when there is more vascularity, the vessels are not very strong, they are very weak, and they have little holes or permeability, and the tumor cells permeate through the vessels into the bloodstream, and the Datar, I'm also told, and I also read a lot about it, that it can pick up even 1, 2, 3 cancer cells in the body and clusters of cancer cells, and can tell us, look, this is a cancer, and they can do special markers to say that this is breast cancer, because there are some special markers in the breast cancer cells. So here we are with a great innovation, and we are happy that we as women, if God takes up with the breast cancer, we will be saved with the help of Datar and the Apollo Hospital.
Good evening. I'm going to keep it brief. It gives us immense amount of excitement and pleasure and honor to be introducing a test like this, not only because I'm a woman, but because I have been in the space of cancer and oncology and working with patients from stage 1 to stage 4 and have understood the importance of prevention and screening. Datar Cancer Genetics has developed a revolutionary technology. It's a simple blood test that can screen for early stages of breast cancer with one simple blood draw in completely asymptomatic individuals. And if we want to experience a cancer-free India, a breast cancer-free India, and a breast cancer-free world, then we have to make early detection and screening a part of our lives. We are very excited to be launching with Apollo Group, Apollo Cancer Centers, to make this test available in the forefront of every woman in India today. Thank you.
Apollo Hospitals Day. Has been said about the breast cancer and the incidence of the cancer worldwide as well as in India. And I'm sure most of you would have taken the take-home message that the breast cancer is one of the leading causes of the death worldwide and is the most common diagnosed cancer worldwide, followed by the prostate cancer. But unfortunately, we are not talking about the prostate cancer here. Main emphasis is being laid on the breast cancer screening and to reduce the mortality and the morbidity caused by the treatment of the breast cancer. As most of the speakers have already said, the cancer incidence in India is around 25.8 per 100,000 women, out of which the mortality is approximately 12.8 per 100,000 women. That means around half of the women who are being diagnosed with the breast cancer do die because of the breast cancer. Now, the breast cancer incidence is rising globally, and it has been found that the per year increase is 0.6%, while the mortality is decreasing because of the advances in screening, management, treatment, monitoring, and follow-up. And most of these cancers in India are diagnosed at an advanced stage, as most of our colleagues and the speakers have made a lot of emphasis on that. It's found that 6% of the breast cancers do present a diagnosis with the metastasis. That means disseminated disease at a stage where it is not curable. It is treatable definitely, but not curable. And out of these 6%, it's only 27% of the patients who reach their 5th year. So it's a grave problem on the resources, on the life, and psychologically, it's a very grave problem which we are facing currently. So the main challenge which is the cancer care teams are facing is the early diagnosis. Though we have improved a lot on our diagnosis and trying to reach to the people so that people come forward for the screening of the various cancers, including the breast cancer. Now, among the ladies, the most important thing is to be aware of their breast. I mean, the similarity of their breast, being familiar with their breast. I mean, that's the most basic important thing. And whenever they are meeting a clinician, even if we are not going for the protocols which are used for the screening, like the mammograms and ultrasound, or we cannot afford it, but still the clinical encounters are equally important in the screening. And most of the times we have seen that the clinicians, if I am a gynecologist, I would just try to concentrate on what the patient comes with the symptom and not try to examine the patient as a whole.
At the moment, it's not a replacement of mammogram. So that's what we said repeatedly. If the test is negative at this point of time, We cannot tell a woman don't go for a routine older methods of digital mammography plus minus ultrasound plus minus MRIs. So at this point of time, I think I'm sure future results will show that just this test in place of mammography might work. But at this point of time,
screening is deficient. And that deficiency is leading to more females coming in advanced stage. Now, how do we enhance the accessibility? How does one get screening from, as Dr. Sareen said, from any city that they are living in, if there is no digital mammography, if there is, reading mammography and reporting is also a skill. It's available only in, advanced centers. This is a blood-based test. So you give your blood sample and you get, and its sensitivity is so high that if it is positive, then you can further on with the other processes and the screening and clinical evaluation. But if the test is negative, then the female can be assured that, under the statistics of the test, it's safely concluded as that there is no evidence of cancer at that time when the breast cancer, when that test is done. So,
can I just elaborate on that a little bit? Screening mammogram, which is the most sensitive test as of till yesterday, till the Datar came up with this. Till yesterday, um, um, also misses cancer is also not standardized the world over. There is a lot of debate. Should we start at 40? Should we start at 50? Should we add ultrasound? Should we not add ultrasound? And also, in addition, you need mammography audited equipment in these small little areas all over the country which we can't afford to. We need personnel to do the test. We need personnel to report the test. We need personnel to reach to the people, come over for mammography, which people think is painful and also radiation producing. So the country at this moment cannot afford to have mass screening with mammogram, which is the most sensitive. So this blood test will possibly doesn't require personnel, equipment, auditing, quality control, and everything else. I mean, they are the quality control.
We have already made it clear that the EasyCheck breast is exclusively through a poll.
Can I just elaborate a little bit? Yeah. Your area only. They also have an EasyCheck 360. You're not discussing that today.
Today's discussion is on
EasyCheck for other cancers. So that would be available to the public at large whenever they sort of launch it in inaugurated. Yeah. But the breast is across the Apollo group of hospitals. All that you need is a patient needs to just come to us for us to write down this test.
In fact, as Sangeeta Reddy's presentation, she mentioned of the helpline numbers. So all you need to do is just screening test. It is not a self-test like a self-COVID test. Here, the blood sample, which is drawn in a tube called the DTA tube, 5 ml of blood sample needs to be drawn by a phlebotomist. So that is what Apollo Healthcare and Apollo Cancer will facilitate. Once somebody gives a call, they will be directed to the collection facility of Apollo where the blood will be drawn. So it is not a self-draw of blood, number one. Number two is that, as you can see, that the very high sensitivity of this, which is way beyond other tests, and the specificity and the detection of circulating tumor cells in the blood is a very advanced technology. I'm sure that with time technologies evolve and costs come down. As of now, we have tried, Datar Genetics has tried to position it at a very, very affordable price bracket where at least in the urban communities and even beyond, females can afford. 6,000 rupees for a test which can be life-changing or life-saving is, I think, a worthwhile investment.
I would further support that something has to go and give your blood, and it's transported to the laboratory wherever the laboratory is, Bombay, Hyderabad, Chennai. In the lab, it's processed and it takes you 10 days to 14 days. It's processed, the cancer cells are separated from the normal RBCs and the normal WBCs. And then the testing is done, does it belong to the breast, does it not? Because it's a big responsibility to say, you have breast cancer. You cannot just be off the hand say that. And to my mind, 6,000 as of now is not too much. Let me just tell you, there is a test called Oncotype DX, which we send to America to see whether you need chemotherapy or not in a certain type of breast cancer. It costs 3 lakhs. And people don't, because they don't want chemotherapy. So if they can tell me your breast cancer is less than 1 cm, you don't need chemotherapy. 6,000 as compared to 3 lakhs. I personally would say that cost effective is a factor for screening, but this 6,000, I think it's cost effective. ICMR has about 21 population-based cancer registries, and they did the incidence rates over a period of 20 years and found that majority of the urban population-based cancer registries have registered an increase in the incidence by about 2%. If it was like 4%, they increased it by another 2%. So the breast cancer is increasing. There is no way you can decrease it because of our lifestyle and because of our diet and the NCDs that our chairman said, non-communicable diseases. We are not having 10 children as we had it 30 years ago in the villages. We're going to have 1 or 2 children or no children. We're going to be fed better, so our period starts early and our period stops late. So the longer the period cycle, the higher the incidence of breast cancer. We are obese, don't look at me, but we are obese and we are not active. With the COVID-19, we're sitting on the computer. No physical exercises is going to increase it. Industrialization. I do not know what we breathe and what we drink and what we eat. Chronic inflammation of the gut or what you eat is also a cost factor for increasing cancer. So we cannot decrease the incidence of breast cancer. Why it happens, the research is going on. We do not know when we get an answer. The next best thing that you can do is to diagnose it early. And diagnose it before you feel alarmed. By the time you feel alarmed, it's stage 2. So before I feel alarmed, before I have a discharge, before I have a swelling, if I'm told by Datar and it's a very specific test, I think that's the happiest news that a woman will get.
The specific study for the breast cancer is about 8,000 plus asymptomatic women who were tested and then followed up. It also had women with benign malignancies and malignant breast tumors. And that is where we detected the sensitivity of 88% and a specificity of 99.9%. So that's the data around this.
To understand that how important early detection of breast cancer is, and you are the ones who are going to spread the word. So we are depending on you to make us aware that how important it is to do early detection in all cancers. It's only early detection which helps in terms of survival. So आप लोगों की मदद चाहिए मैम इस आश्चर्य को बदलने में एक रिस्पॉन्सिबिलिटी है सो दैट यू स्प्रेड इट अक्रॉस द सोसाइटी सबको आप बताएं आप लोग लिखें पेपर में कि एक इजी चेक ब्रेस्ट करके टेस्ट है जिससे कैंसर जल्दी डिटेक्ट होता है और हम सब बच सकते हैं हम तो करेंगे ही थैंक यू फॉर केयरिंग फॉर अस थैंक यू फॉर ट्राइंग टू टेल अस दैट वी नीड टू टेक केयर ऑफ आवरसेल्व्स
कॉमन मैन ऑन द स्ट्रीट को नहीं आपकी राइटिंग से तो डॉक्टर्स भी पढ़ेंगे पैरामेडिकल भी पढ़ेंगे हम उतने डॉक्टरों को नहीं रीच कर सकते इन मीटिंग कॉन्फ्रेंस 100 200 300 500 1000 हो गए आप तो करोड़ों में पहुंचोगे
when you were holding those and you were meeting all these survivors of breast cancer, young lady of 24, 25, and some of them, just married, she had a kid of 2 years. So why are you giving only for giving a 40 years? When we see number of ladies with breast cancer at 30s and 32, you guys have seen that.
There is a stratification. When we are talking about the average risk patients compared to the high risk patients, those high risk ones will be, you have to classify them, right? So those high risk will be the patients, not the patients, and the individuals who have a family history of breast cancer, whose family member, immediate family member has tested positive for the germline mutation, and the healthy patients who have received the radiotherapy to the thorax at the age of 10 to 25 years, and the patients, again the healthy individuals, I'm sorry I'm using the word patients again, the healthy individuals who have atypical hyperplasia are lobular carcinoma in situ, or we have the various models in cancer and the algorithms which we use to classify and put the healthy individuals into the different groups. Same is for the breast. We have various models to put them into the groups. As per the Gale model, which is usually most commonly used worldwide, again, the healthy individuals who have a lifetime risk of more than 1.7% becomes a high risk patient.
कहती है मैडम मैं क्या कर सकती थी, और हम कहते हैं कुछ नहीं कर सकते क्योंकि कोई टेस्ट है ही नहीं. There is no sensitive test for you to undergo, for a normal person. Never mind the high risk. High risk is a very big one. So for younger people, we do not have a screening test. And there were women just married on a honeymoon, found a lump, found a cancer, no children, but there is no test. So I am told the FDA has approved only above the age of 40, but they would be studied. If below the age of 40, from 30 to 40, this test can be done, and we have accurate and as specific. But for the time being, the FDA approval is above the age of 40. But from 30 to 40, there is a good chance. Yes.
I'd just like to add that the test, so any woman below the age of 40 can also take the test, but with a prescription. So as Dr. Saeed said, there is a certain age that the US FDA has given us a breakthrough device designation on, but that does not mean that women under the age of 40 can't do the test. I've done the test myself, I'm 35, but we recommend it coming with a prescription.
First of all, this test comes to the care protocol mentioned on the report. Once the test is positive and there is no evidence of a physical lesion, of course the patient will go for a clinical evaluation, will be evaluated through radiological methods as well as clinical methods. And if still there is no lesion, then we advise a quarterly follow-up to be kept, because this detects ductal carcinoma in situ or stage 0, which may not be evident on any other physical modalities. These are circulating tumor cells being shed from a very early tumorigenic mass, and that's the advantage of the test. And the other factor is that it should not be related to overt apprehension, because specificity is close to 100%, that these are patients who will develop physical lesions sooner than later. And it still gives the advantage of time, because as soon as a physical lesion is detected, then the clinical intervention can start.
So, the power of Easy Check Breast is that this is not only a highly sensitive test for breast cancer screening, it is very specific. There are no false positives in this test. Every person who, if detects positive on this, can be then taken to the next level of treatment or care. And the second is that it is possible to do this test is done on blood, so you don't need to come to a hospital or a big hospital, take an appointment. You just need to get the blood sample and at the collection center and get this test done. and reports are available within 10 to 14 days. So once the report is there, if it is negative, you can rest assured that there is no breast cancer evidence in the body at this stage. If it is positive, then you can go for the further clinical management.
जी बहुत बहुत धन्यवाद। आपने ईजी चेक ओनली ब्रेस्ट कैंसर के लिए है सर, जो जेंट्स हैं उनके लिए
जी
कैंसर के कुछ सिस्टम पाए जाते हैं
जी,
वो कैसे, वो भी इसी तरह से चेक हो पाएंगे सर?
आज का जो समारोह या जो इवेंट है अपोलो हॉस्पिटल के साथ में, वो ब्रेस्ट कैंसर के लिए है। इसके अलावा जो इजी चेक 360 के नाम से टेस्ट है, उससे 30 डिफरेंट कॉमन कैंसर्स डिटेक्ट हो जाते हैं, तो वो भी एक अलग टेस्ट है।
तो वो भी इसी तरह से हो पाएंगे सर?
हाँ,
जिस
वो
तरह से
दतार
आपने
कैंसर जेनेटिक्स से आप
ये एक फर्स्ट अपने एरिया में बाई लॉन्च हुआ है
जी,
लेकिन जो गवर्नमेंट हॉस्पिटल हैं या और अदर हॉस्पिटल हैं उसमें भी इस तरह की फैसिलिटी है या इसके बाद आप प्रोवाइड करवाएंगे?
दतार कैंसर जेनेटिक्स तो एक इंडियन कंपनी है और इसकी सेवाएं जो हैं वो सभी इंडियंस के लिए उपलब्ध हैं। हमारा जो कस्टमर सपोर्ट नंबर है या जो सपोर्ट ईमेल है, उसमें कोई भी अपना ये डाल सकता है रिक्वेस्ट कि भाई मैं कैंसर स्क्रीनिंग टेस्ट कराना चाहता हूँ या कराना चाहती हूँ, और दतार कैंसर जेनेटिक्स पूरे पैन इंडिया जो है ये सपोर्ट प्रोवाइड करते हैं कैंसर स्क्रीनिंग का। लेकिन आज का जो इवेंट है ये ब्रेस्ट कैंसर स्क्रीनिंग का, ये प्योरली अपोलो हॉस्पिटल के साथ में।
इसके बाद आप अदर हॉस्पिटल में भी ये फैसिलिटी आप ही प्रोवाइड कराएंगे या इसमें गवर्नमेंट भी इन्वॉल्व होगी?
नहीं, ब्रेस्ट कैंसर की बात करें, ब्रेस्ट कैंसर एक्सक्लूसिवली अपोलो हॉस्पिटल के साथ।
मतलब बाकी अदर हॉस्पिटल या गवर्नमेंट में
अगर
आप ये
किसी को
फैसिलिटी
कराना है तो वो अपोलो हॉस्पिटल
में ही आएगा?
जी जी। और इसका रीज़न ये है कि अपोलो हॉस्पिटल एक बहुत ही विशाल प्राइवेट हेल्थ केयर ग्रुप है, और इसका आउटरीच जो है पूरा नॉर्थ साउथ ईस्ट वेस्ट इंडिया सब जगह है। तो पेशेंट सिर्फ टेस्ट ही नहीं, वो अपना बाकी कैंसर का जो इलाज जो पॉजिटिव डिटेक्ट होंगे वो सारी चीज़ें भी
आराम से करा
हो पाएंगी।
तो ऑल ओवर इंडिया जो है हमारे जितना स्टेट और यूनियन टेरिटरी है वहाँ भी आप हर जगह ये फैसिलिटी प्रोवाइड करा पाएंगे या दिल्ली
हमारी
वासियों के लिए?
कोशिश ये है कि हम इसे कोने कोने में लेके जाएं और सारे स्टेट्स और इवन पिछड़े जो जगह हैं वहाँ भी लेके जाएं। तो वो एक मिशन है जो हमने शुरू किया है, अभी उसको आगे लेके जाना है।
6,000 आपने इसका कॉस्ट बताया है, तो जो आम नागरिक है, जो गरीब है और जो रूरल एरिया का है उसके लिए कुछ आपने?
इसके लिए हम चाहते हैं कि भाई देखिए, बिकॉज ये टेक्नोलॉजी इतनी एडवांस्ड है कि ये एक आम टेस्ट की तरह नहीं है, इसमें कैंसर के एक सेल को भी डिटेक्ट किया जा सकता है। तो इसके लिए अब और ग्रुप्स को आगे बढ़ के आना पड़ेगा, और कि किस तरह से जो सोशली लोअर इनकम ग्रुप के लोग हैं उनको सपोर्ट मिले और वो ये टेस्ट करा सकें।
क्योंकि सर
हिंदुस्तान में हमें भी चाहिए कि हम चाहते हैं कि जो पूंजीपति हैं या बिजनेस हाउसेस हैं या सरकारें हैं वो भी सपोर्ट करें
गरीब जनता के।
जी, वो मिशन को हमारे साथ में जो है कंधे से कंधा मिला के इसका रिस्पॉन्सिबिलिटी ले।
जी, पूरे हिंदुस्तान और पूरे वर्ल्ड में अपोलो का एक नाम है
जी।
इसी वजह से है कि हर आदमी जो है वहाँ पर अपना इलाज नहीं करा पाता है।
मैं ये नहीं समझता हूँ अपोलो के जो हार्ट के केयर के मिशन हैं या और बीमारियों के हैं वो बहुत ही वाइड तबके के लोगों तक पहुँचते हैं, और लोग गाँवों से और छोटे शहरों से भी इलाज के लिए आते हैं। तो ये मैं कहूँगा कि एक शुरुआत है, जब कि अपोलो हॉस्पिटल के साथ में इस मिशन को लॉन्च किया जा रहा है, और आने वाले समय में जैसे कहते हैं कि जैसे जैसे जुड़ती जाती हैं कड़ियाँ एक के साथ एक, तो इसको और बड़ा रूप मिलेगा आने वाले समय में।
तो ये बहुत अच्छी बात है। हम प्रधानमंत्री नरेंद्र मोदी जी से और स्वास्थ्य मंत्रालय में इस बात को रखेंगे और वो सभी जो है इस बात को बढ़कर आगे आएँ और सबका साथ सबका विकास की जो रणनीति है मोदी जी की उसमें सहयोग दें। आपका
सबका स्वास्थ्य
सबका स्वास्थ्य बहुत बढ़िया बात है। तो थैंक यू वेरी मच सर, बहुत बहुत धन्यवाद, नमस्कार।